Dr. Richard Pan. Dr. Pan, it's Dave. Good morning. How are you?
Doing all right, as much as we can say that during a pandemic, but thank you.
Dr. Pan, would you say potato salad is an acceptable breakfast snack or no? You're a medical doctor, so I just asked the question. I'd like your opinion.
Well, no comments on potato salad for breakfast. I just, it's a good food, a little high on the fat side with all the mayonnaise.
I guess the way I'll start out with you is this. I see a lot of us are seeing spikes. A lot of us are confused between, is it a spike because of testing and more testing? Now they're starting to look at the number of hospitalization spikes. How would you grade us right now in the midst of the pandemic? How are we doing as a country? How are we doing as a state?
Well, first of all, I want to say is that this is not, quote, the second wave. This is still the first wave. When we talk about waves, we never eliminated coronavirus. I should say eliminated, quite word, but we haven't basically suppressed it from our community. So it's still out there. We had flattened the curve. We were on the flat part of the curve for a while. It never really went down significantly. And then what we're seeing now is basically what happened when people were exposing themselves during Memorial Day weekend and some of the lifting of the stay-at-home orders that were taking place in different parts of the country a couple of weeks ago. So it's usually a 2 to 3 week lag in terms of what you see in terms of cases and hospitalizations. While testing has gone up, this is not primarily due to increased testing. And we know that because we look at the rates of positives in the testing. Also, testing has been continually going up as well. So this is not really explained by testing. If you see what happened in Sacramento County, and I think there were some news reports about it, there has been a rise in hospitalizations as well as positives, and it seems to be associated to, they've traced it back to people having gatherings, particularly indoors, right? So when people are spending time with each other in closer quarters indoors, so if they have a birthday party or a funeral or some other gathering where they're bringing people from lots of different households. I understand one of these gatherings included people who came in from out of town, and you're all spending time together, close up, an extended period of time with each other, then there is a higher risk that there's going to be an outbreak or an event of spread if somebody's positive. So that's why we remind people to try to stay some distance from each other, 6 feet away if possible. Wear a mask because that makes it less likely you'll transmit the disease to people. I think there's increasing evidence that the mask wearing that we saw in Asia is a contributing factor to why we see slower spread in countries like Taiwan, South Korea. New Zealand's been very successful. So these are really basic things for people to do to help slow the spread of this disease, which is picking up. And unfortunately, you can see what's happening in Arizona. They're filling up their ICUs and their hospitals. And we're seeing more cases in Texas and Florida and unfortunately here in California as well.
Dr. Richard Pan with us, and we're not here to get political about it. It's a medical question, and we had said before on the show, and we're probably quoting you or somebody else like you, that the virus does not care about a cause. The virus does not care about morals and ethics. The virus does not care how nice of a person or mean of a person you are. The virus is the virus. So let's have a quick conversation about the protests. And you see masks out there. But, I think it's fair to turn the spotlight on that, just like we turned the spotlight on the protests from people that wanted out of their house a few weeks ago, although completely different motivations for the protests. The fact of the matter is you have large groups of people in close quarters that are, possibly asymptomatic or have the virus itself. How worried or how much did that add to your worry when you saw all the protests around the nation that could possibly lead to a second or third or fourth spike?
Well, certainly, I think it's something that is of concern to many people in public health that this may cause some further spread. At the same time, we also need to acknowledge that coronavirus itself is disproportionately affecting people of different races. So, for example, here in California, we see that the Black Americans are dying at least twice the rate of other Americans. So this is across the country and even in California. So why is it that they are dying at twice the rate as everyone else? We see that Latinos are more likely to get infected. This is probably because they disproportionately work as essential workers, particularly in the more lower income jobs where they're picking our food, working in grocery stores, cleaning hospitals, things like that. As well, so the higher proportion of Latinos are working, as well as actually some of the Black Americans as well, are working in these essential jobs as well, where they can't stay away. Right, they're required to do so, and also I think we need to point out that Black Americans are dying not only of COVID but of other reasons, including the protests were about police brutality, and we saw several examples of that in the past week, and that's related to the protests and so forth. So we can't say, well, we don't want to speak out about how people are dying because of the pandemic. Now, I would also point out that the protests are generally they're outside where risk is lower. People are wearing masks. And I think there's, probably not as spread out as we would like. Certainly, I think some people took some efforts to try to spread out. Sometimes they were pushed together, in depending on how some of these protests were being contained. But I think it's certainly a difficult challenge. One of the things I should point out, though, because we talk about mask wearing, this is truly a dilemma for Black men about wearing a mask because, as I said, they're more at risk of this disease if they catch it, but they're also at risk when they wear a mask, not of COVID, but of being
profiling.
Because of basically they're viewed as a threat unfairly, and they're at more risk of potentially being attacked or arrested or being assaulted, and if they are wearing a mask, and certainly being discriminated against even more for wearing a mask. People find them, unfortunately, more threatening that way. And so that becomes a big dilemma, right? And so imagine that you know that on one hand, you're trying to protect yourself against this disease that's killing people like yourself at twice the rate of everyone else, which is very bad enough without that. Add that on top. Or if I wear the mask, I'm more likely to get arrested, go into jail where I can catch the disease, actually get shot. And so I think the protests also kind of acknowledge that dilemma and that problem.
Well, and using the points, as we talked to Dr. Richard Pan, using the points that you just made, and again, trying to take the cause, the politics, everything out of it, and just speaking medically and statistically, you made some very interesting points that people of color have a higher rate of death for an assorted amount of reasons when it comes to COVID. What am I correct in being worried? And I always try to come, Dr. Pan, as I know you do, from a point of human life and staying healthy and having less people be infected and die from this, and that is where the basis of everything that I worry about is my neighbor and my fellow human being not suffering from this. It does worry me a little bit that I feel like the media is in a difficult position. I don't want to go too far off the reservation here. I want to stay medical, because you saw the reporting on the protests at the state houses, which, let's be honest, were largely Caucasian men and women that were out there with and without masks, but in lesser numbers than we're seeing right now. So they're out there, and based on what you just said, which is factual, by the numbers, have a lower mortality rate than people of color. So you have less people during those protests, and you have a lower mortality rate of most of the people involved in those protests. And the media coverage was very much, there was a lot of forget how you feel about the protest. This is very dangerous. This could be a secondary spike. These people got to stay home. Now, to your other point, hey, you're in an impossible position. Protest. You're dying. There's brutality. You have to go out there, and you have a righteous cause. There's no doubt about that. But again, from a medical standpoint, it does worry me a little bit that we kind of have, I think, a much softer media stance on these protests when in fact it is an impossible spot for everybody, because you now have a larger amount of people. To your point, you may have less mask wearing for all the salient points you brought up, and you also have a larger percentage of those protesting that have a higher mortality rate for all the very good reasons you laid out. Am I right to be worried about maybe an even worse spike because of the amount, because of the mortality rate, and also because the media seems to be backing off of it a little bit?
Well, certainly I think there is concern about a continued rise in cases. I would point out the rise that we're seeing now is probably not related to the protests. Most of them have been traced back to people basically during Memorial Day weekend, and as we're lifting our public health stay-at-home orders, are getting more relaxed about it. One of the things I do want to remind people is that even as we're lifting some of these orders so that we can open up more stores and other types of things, what we're not doing is we're not telling people they don't need to continue to take precautions, right? Please try to avoid non-essential travel, non-essential, going out. Please wear masks. Please try to keep that physical distance because that's still very important. And what we're saying is that people can get out and about more, but again, be very conscious of this. Now, in terms of the protests, I would also point out fundamentally some of the earlier protests in the Capitol were really about protesting for actions that would actually further spread the disease, right? They were protesting, so not only were they not wearing masks, they were basically saying we should allow people to, they opposed the public health orders for people to try to stay the distance. They're opposing contact tracing, which is going to be essential to contain this disease. They're protesting even a potential future vaccine that will allow us to essentially potentially eliminate disease. We don't have a vaccine yet, so we don't know what it can or can't do in the future. So on one level, you have a group of people who actually are protesting the fact that we're trying to stop the disease, versus more recently we're having protests to really protest why people are dying to try to prevent death, right? The protest wasn't about COVID as much about other ways people were dying, right? From police brutality, from racism, chronic racism, and so forth. So I would think that we should, one could argue that that's political or not, but I think we need to look at what the purpose of each of the different protests are as well.
Dr. Richard Pan joining us. Doc, we get all kinds of questions for you. This one not really directly related to coronavirus, but I think it's an important question. It's one that I see a lot, and this is as in your wheelhouse as anything else could possibly be. This is the question. I have a friend who has a 4 and an 8-year-old daughter and a 10-year-old son. He is not allowed a single vaccine to any of them. Everyone pressures him to vaccinate his children, but his counter is they are the healthiest kids he knows, and that he builds their immunity by a healthy diet and lifestyle. And I can't argue, because I've never known them ever to be sick, and I've known them their entire lives. How can I reason with him? What are some pointers?
So, first of all, I appreciate that he is trying to be as conscientious as possible as a parent to keep his kids healthy in terms of diet and the other things he's doing around their wellness. so appreciate his attention to that. I would also point out that the science shows that just because your child is healthy, and that doesn't mean that they won't potentially catch a infection, right? A contagious disease. The reason it's called contagious is because it goes from person to person, right? And that their his children are being protected by the fact that other people are vaccinated. That's why we don't have widespread outbreaks of many of these vaccine-preventable diseases when people are vaccinated, because that's that community immunity we develop. So that protects children who are not vaccinated. That includes children who cannot be vaccinated. Those are the children who might have transplants, who are being treated for cancer. They can't be vaccinated. They're still at risk of catching these diseases. So that's why it's important everyone gets vaccinated. And then, of course, that includes his children, but the problem is his children could be vaccinated, which would both protect them and protect other children. So what happens is that essentially his family is free riding on everyone else's actions to be responsible. And so that becomes a public health issue if too many people are bringing unvaccinated children together in a school or somewhere else. So certainly he has the right to decide whether he wants to vaccinate his children or not. We can get into a debate about it's his children's, not him, so as the way he may be putting his own children at risk, but certainly he's the parent. He has the right to do so. But we also have the right to protect other children, and that's why we passed the laws we did, which we're not to force parents to vaccinate their children, but we're to ensure that we keep our schools safe.
Last question for you, Dr. Pan. Was reading an article early this morning that there's some conversation about using, correct me if I'm wrong here, an oral polio vaccine to possibly help prevent the onset of COVID-19. I'm putting you on the spot. I assume you've seen those reports. And is that something that excites you as being a possible preventative of the disease itself?
So there's actually a theory out there which has some evidence behind it, but it has to be studied more carefully, which is that when you get a vaccine, particularly a live virus vaccine, so you talked about oral polio, we actually do see this with the MMR, the measles vaccine, which is a live virus vaccine. There's also been some discussion about, and I think I actually mentioned it on the show, this TB vaccine called BCG that we don't give here, by the way, in the United States. It's given in other parts of the world. So we don't give it here in the United States. That seems to show that not only does the vaccine protect against the disease you're immunizing against, so the polio, the measles, or the tuberculosis, but it also stimulates the immune system in a way that seems to make the body more resistant to other types of infections. And some people have said, well, look, countries that give the BCG seem to have a lower rate of spread of this novel coronavirus. And so I think there's some similar things people have said about the oral polio, because here in the U.S. we don't give oral polio, we give the injectable polio, and that's because unfortunately with the oral polio, very, very rarely, but it does happen, is that being a live virus, very, very rarely some people have actually gotten polio from the vaccine itself. Again, a very, very rare occurrence, but that doesn't happen with the injectable polio vaccine because that's not a live polio virus. It's our weakened virus, but it's actually just the polio components, so it's the virus is dead. And so some people have pointed out that, yes, places that people have received live polio or BCG seem to be possibly at less risk of spread of this coronavirus disease, and they think it may be perhaps related to the stimulation of the immune system that we see. And we also actually, by the way, see this in measles. So people who get measles itself, actually their immune system is suppressed, and so they're more at risk not only of many other diseases as well. So the measles vaccine actually has a protective effect not just against measles, but against the suppression that actual live measles infection causes, which causes you to be more vulnerable to many other diseases as well. So there's So there's some investigation or talk about that, but I don't think at this point anyone's seriously talking about starting to give everyone live polio vaccine or the BCG here in the United States as a way to slow down or stop coronavirus.
Dr. Pan MD, that's Dr. Pan MD, at Dr. Pan MD is how you can follow Dr. Richard Pan for all kinds of updates and information, not just on coronavirus, but smart medicine in general. Doc, we always appreciate the public service you give us each and every week. We'll talk to you next Friday.
Okay, thank you, Dave. Can I just say one other thing before we go?
Please.
And I do feel compelled to say this because this past week, actually, not just when I say past week, this past week, we've had 2 public health officers resign because of bullying and intimidation. So we have Dr. Quick, who was the public health officer in Orange County, resigned on Monday night. She was receiving death threats. We had an anti-vaxxer announce her home address at a Board of Supervisors meeting, and then people showed up at her house. We had Dr. Acton, who's the public health officer for state of Ohio, which was a Republican governor, so this is not about partisanship. She had been continually harassed and attacked and received death threats. Our public health officers are trying to make decisions based on science, based on the facts. They should not be bullied and harassed. They and their families should not receive death threats. That's not the way we need to do things. We've lost 7 county public health officers here in the state of California since mid-April. We can't keep losing people. Now, some of them had previously planned to retire. Other ones may just feel like they're overwhelmed. But the fact that we lost a public health officer to essentially bullying, intimidation, and death threats is really inappropriate and unacceptable. We need our county public health officers to be honest with the public and to recommend the best possible things to keep us safe. So I just feel like I have to say this because we cannot continue to allow this to happen. We cannot have our public health officers making decisions because they're being threatened and bullied and receiving death threats.
Smart words, and I couldn't have said it better, and you're 100,000% right. That's a terrible thing going on right now. Dr. Pan, as always, thanks for your wisdom. We appreciate you.
Thank you.
Thank you.